First, it was COVID patients, then victims of gun violence, public health crises that have both created a one-two punch, basically, for many hospitals and frontline medical workers in the city. Now, doctors at one of the busiest trauma centers in New York are worried that they could be in the middle of both this winter. With the story, here's New York One's Lydia Hu.
As Jamaica Hospital's trauma medical director, Dr. McKenzie oversees the treatment of people who are seriously injured, often as a result of car crashes or gun violence.
COVID cases are increasing. What we are trying to do is...
There's a lot to discuss in the morning's handoff meeting with the overnight team. 3 trauma patients arrived early this morning.
We usually have one come in at a time, but it's not unusual to have them come in multiple.
This is a level 1 trauma center, a designation for hospitals providing the highest level of trauma care. For example, by having a trauma surgeon on duty at all times. Back in March, McKenzie's team also had to help the hospital deal with a surge of critically ill COVID patients.
We, are the only trauma center in Southern Queens. We have a huge catchment area, and we really feel a need for the community. And so maintaining that services was a huge priority, but it wasn't easy. It was really, really difficult.
Then when COVID admissions started to decline as the weather turned warm, Jamaica Hospital began to see an influx of another kind of patient, victims of gun violence.
And you don't really know if that's a trend or not yet, or if it was just a bad weekend or a bad week or a bad couple of weeks.
By Labor Day, the hospital treated more gunshot and stabbing victims in 2020 than in all of last year.
But it just feels like the wave kind of never subsided. And I think that's another reason why everyone's, fearful and worried about the winter and what's behind the corner,
With COVID cases rising again and gun violence remaining a problem in the city, McKenzie is concerned that the hospital could be caught at the intersection of 2 public health crises.
And if you have those 2 things happening at the same time, you can imagine the stress that does to our healthcare system here in New York.
The hospital currently has about 30 COVID patients. That's still well short of the 300 patients during the initial peak of the coronavirus crisis in the spring. But McKenzie and her team know how quickly the numbers of both COVID patients and gun violence victims can increase.
Thinking about the possibility of going through that and maybe even being worse is a scary prospect for anybody.